Good morning, everyone, and thank you so much for joining us this morning. My name is Kira Acuna, and today's webinar is on working adults with disabilities with home and community-based services, or HCBS, and this is going to be referring to the changes and updates coming soon. So really quickly, who is HCPF? So HCPF is Colorado Department of Healthcare Policy and Financing. It is designated as Colorado's single state Medicaid agency, and it's responsible for the supervision and oversight of Colorado's public health insurance programs. You can visit our website. I believe Sarah might be dropping the link to our website in the chat for you all. HCPF's mission is improving healthcare equity, access, and outcomes for the people we serve, while saving Coloradans money on healthcare and driving value for Colorado. And really quickly, what we do is the Department of Healthcare Policy and Financing administers Health First Colorado, which is Colorado's Medicaid program, Child Health Plan Plus, or CHIP Plus, and other healthcare programs for Coloradans who qualify. So what you can expect today is this is an informational meeting, and you all will have the chance to ask questions and provide comments about the presentation. And this meeting is being recorded and will be emailed out to everyone who registered for today's webinar. There are a few ways that you can ask questions. So you all, I believe, are currently muted. So if you did want to ask a verbal question at any point, please just raise your hand and we can unmute you. Otherwise, we will be directing you towards the Q&A box. So if you have questions that you would like answered out loud, please do drop those in the Q&A versus the chat. And then finally, you can also, if questions come up after today's webinar, you can email Nancy Brenes as well. And I believe Sarah will be dropping her email in the chat as well. And with that, I'm going to hand it over to Nancy Brenes.
Alrighty, thank you so much, Kara. Alrighty then, so I will be talking to you about working adults with disabilities and HCBS. We'll go ahead and get a little bit deep on this. We're going to be talking the overview, what is WAD with HCBS, what changes are being made, and what is the impact of those changes. Next slide, please. So what is working adults with disabilities, which we reference as WAD? So WAD, the Working Adults with Disabilities, lets adults with a disability who qualify to buy into Health First Colorado, which is, as Kira mentioned earlier, the Colorado's Medicaid program. If you work and earn too much to qualify for Health First Colorado, you may qualify through this program. If you qualify, you may pay a monthly premium. Your monthly premium is based on your gross monthly earned and unearned income after any applicable disregards. Next slide, please. So eligibility guidelines. You must be 16 years or older. You must be employed. We don't have a minimum amount of hours or a minimum amount of salary or wages that you need to earn, but you do need to be employed. You must have a qualifying disability, either through Social Security or the state's disability determination vendor. Even if you are 65 or older, the Social Security Administration listing describes what disabilities qualify. And your income after disregards must be below 450% of the federal poverty level. So, for example, you can earn up to $11,020 a month and still qualify. You may have additional disregards to that income that could be applied as well. Next slide. Because of these additional disregards, applicants should always complete the Health First Colorado application to find out if they qualify. I'm giving you some rough numbers, but they might be other applicable circumstances, so it's always important to go ahead and submit that application. Now, you are not required to apply for SSA disability if you do not have a current disability determination from SSI. Then you just need to fill out the Health First Colorado disability application, so our state vendor can make that determination instead. Resources and assets are not considered for this program. So as an example, we have here checking and savings account, vehicles, property owned, none of those would be considered for this program. Next slide, please. So what is WAD with home and community-based services, which is HCBS? Next slide. So in addition to Health First Colorado benefits, members could also qualify for extra long-term services and supports. These additional services are accessed through the following HCBS waivers, which would be the brain injury waiver, known as BI, the community mental health supports waiver, known as CMHS, the complementary and mental health supports, well, that one I already said. Sorry, the complementary and integrative health waiver, which is known as CIH, the developmental disability waiver, known as DD, the elderly, blind, and disabled waiver, known as EBD, and the supported living services waiver, SLS. So if you have one of these waivers, you can qualify for HCBS, which gives you extra services in the home. Next slide, please. So what is changing? Next slide. So we're going to be discontinuing auto enrollment into WAD with HCBS at enrollment and renewal. And I do want to make it very, very clear that this is specifically for WAD with HCBS. So it's not everybody in WAD, it's only members in these waiver services that I mentioned earlier. Members will need to opt into WAD with HCBS if they want to be considered for the program. Members will now be reviewed for long-term care, known as LTC eligibility. Next slide, please. So why is this changing? So many members have not experienced premiums. As such, we do not want to place them in a premium paying program first. We want to inform a buy-in program participation being voluntary and something that can be opted in or out as requested by members. When the public health emergency started, we decided to put a pause on all premiums for our buy-in programs, which are the working adults with disabilities and the children's buy-in. These premiums are now returning, and that's why it's important for us to make sure that all members are aware of this change, that there's going to potentially be premiums depending on your income. So that's part of why this change is occurring. Next slide, please. Here we have a bit of a timetable of these premiums returning. So for the working adults and for the children with disabilities, these will resume in May of 2025. On February 8th of 2025, we actually sent out a heads up letter to all buy-in program members, letting them know that these premium letters will be sent out to them on April 23rd of 2025 with a due date of May 15th of 2025. Those premium letters contained a statement that details the premium amounts, the premium payment methods, and other details associated to those premiums. Next slide, please. So what will this look like? Members will now be reviewed for the long-term care program. So all eligibility requirements for that program must be met. If a member is not eligible, then they will be reviewed for WAD and other programs. If a member is found eligible for long-term care, but the member wants to be evaluated for WAD with HCBS, the member will need to opt into the WAD program. Something that's very important is that though you will be reviewed for long-term care first, if those requirements for that program, the eligibility requirements aren't met, you will still be evaluated for WAD and WAD HCBS. So you won't have to opt in or out in at that point. It's only if you're evaluated for long-term care and you're placed in that category and you want to go to WAD, that's where the opt-in portion would come into play. Next slide, please. So what is the difference of how this is going to look between new members and ongoing members? For new applicants to require HCBS, they will be reviewed for the long-term care HCBS program first. If found eligible, they'll be placed in that category. If members prefer to be in WAD, as I mentioned earlier, WAD with HCBS, they can opt in to be reviewed for buy-in program eligibility as well. For ongoing members on WAD with HCBS, they will be reviewed for long-term care HCBS upon renewal. So Again, they're going to continue in water with HCBS, and then at renewal, if found eligible, they'll be reviewed for LTC, HCBS, and if found eligible, they'll be enrolled into that program. However, again, members can decide to opt back into WAD if preferred. So key components here are the fact that you can opt in or out of WAD at any time. These is a voluntary program. We want to make sure that anyone and everyone that is in the WAD program understands that there are premiums that are coming back to the program, and that they do have the option with this change that we're putting into place to be enrolled into long-term care where there will not be a premium. So we will be evaluating for long-term care, but again, WAD is something that can still be opt-in at any time. Next slide. So the impact of the changes is going to impact the new application processing and eligibility review, as well as renewals. There's an expected impact for both applications and renewals to occur starting June 2025. That's when these changes will be implemented. So again, June 2025. And then the third impact would be all eligibility requirements for the long-term care program must be met, which means that some eligibility sites will need to reach out further to our members to confirm eligibility requirements. That is a case-by-case scenario. Like that might be the case, but we also might already have everything that we need on file to make the determination. So we're mostly just talking about the impacts to application at this point for the eligibility requirements. Next slide, please. So as I mentioned earlier, on February 8th, we sent the heads up letter. This is a sample of the heads up letter where it talks about, how can you make payments. It talks about how to contact us. It will give information on premiums. Can you go to the next slide, please? It gives a brief history of when we suspended the premiums, how they're coming back, and we're resuming normal operations. And then it also gives information on how to contact us if there's any further questions. Next slide, please. This is an actual sample premium letter. The actual premium letters would be in April, as mentioned earlier, and it will tell you how much you owe, when it is due. It will tell you how you can pay, any billing questions, how to contact us, our phone numbers, and any other information related to the premiums. Next slide.
Okay, and with that, we're going to open it up to questions. I did just want to quickly address, because I know the hosts and panelists are receiving a number of questions about the slides. And so I just want to reassure everybody on this webinar and those who registered for today's webinar but are not able to attend, everyone will receive by next week an email with a recording of today's webinar as well as a copy of these slides. And so you will all receive a copy of the slides by end of next week at the very latest. Additionally, I do think that we will be posting these to our Working Adults with Disabilities buy-in program webpage as well. So you will be able to access those via that HCPF webpage, or you will receive the email as well with a copy of the slides and a recording of today's webinar. And with that, we do have a number of questions already in the Q&A. Again, if you have questions, please drop those in the Q&A versus the chat, as we're not monitoring the chat necessarily for verbal questions. So again, please drop those in the Q&A. So with that, Nancy, let me start at the top. So Janelle is asking that $11,020 was never updated after 4/2024.
Correct. So those are still technically currently the values. The 2025 number is going to affect April 1st. So that's why we still have the 2024 value. Once April 1st, 2025 comes in, our website that I believe was linked will have the updated values.
Thank you. Sarah is asking, does the income chart for WAD reflect the limits after deductions disregards? I'm assuming yes, since the cutoff shows $5,846, even though the actual limit is around the $11,020 as you mentioned.
Correct. It is after any and all applicable disregards.
Wonderful, thank you. Laura is asking, will there be new questions in PEAK that indicate the client wants to be evaluated for WAD?
Yes, there will be a new opt-in, opt-out radio button to go ahead and select if you wish to be a part of the program or not.
Thank you. Mary is asking, my son was automatically put into the buy-in program 2 years ago, but has never paid for it. Does he need to opt in now? He did not receive a letter.
Okay, so in this case, he will remain in the. Actually, I'll take that back. If it's just the buy-in program, then it will remain the same. If he were in the buy-in program with HCBS, which is this change specifically for, then he will still remain on that, but at his renewal point, that's where he will be evaluated for long-term care, HCBS. So again, it will depend on whether he's on HCBS or not. If he is not, then everything will remain the same. February 8th is when the letters went out, so they should have gone out. If for some reason he did not receive it, he can log in into PEAK, and there he'll be able to see the information as well. Also in April, he'll be getting his first premium letter, which isn't due until May. So he should still have time to go into PEAK and get that information online. Hopefully it's still in the mail, but if not, that's also a viable option.
Fantastic, thank you. Jeff is asking, does this basically mean HCPF is returning to the policy that was in place prior to February 2020?
I believe this, I can't tell you exactly when the implementation of this auto enrollment was made, but I do know that it was before. We're going back to what we had before the premiums were paused. Again, a big driver behind this is the fact that if a member could be in long-term care without paying a premium, then it would be beneficial for the member to do so. But actually, you know what? It is February. Now that I think about it, it is February of 2020. So yes, the answer is yes.
Thank you. Sarah is asking, can you please explain why someone who qualifies for long-term care or LTC might prefer to decline that coverage and opt into the working adults with disabilities instead?
Yes, so a significant factor that drives a lot of our members to go into the buy-in program is that it does not factor in assets or resources. So, for example, as I mentioned earlier, if you have like multiple vehicles, if you have several properties, things like that will not count towards your financial eligibility requirements. Also, the thresholds for monthly income are going to be significantly higher than for the long-term care program. So the short version is you're allowed to have a higher income, assets, resources, and in exchange for that, so to speak, then you pay a buy-in premium.
Okay, thank you. Andrea is asking, what do you recommend patients do that currently have general Medicaid that is ending, but have applied for working adults with disabilities and haven't received a response yet, so they do not have a gap in coverage?
So I would obviously need to know what the reason for it ending is. Unfortunately, I'm unable to give a blanket statement. However, I can say that if they are applying for WAD does have retroactive coverage of 90 days. So there should not be a gap in coverage in that regard. I know that the state disability determination can sometimes take a few weeks to come in, but again, the retroactive coverage should take care of any gaps as long as they're 90 days or less.
Thank you. Joseph is asking, if someone qualifies for long-term care, Why would they want to opt into WAD? Are more services available to them? Did you have anything else to add to this question?
No, it is the same answer, especially again, since we're talking about the HCBS population, those extra long-term supportive services should be the same for long-term care and for WAD. So it all comes down to assets, resources, your income, and again, buying into through a premium.
Fantastic. Thank you so much. Desiree is asking, do you know the max income amount beginning April 1st, 2025?
I can, so they have not been published yet, but I did already have the calculations for 2025. So bear with me. And again, these are not published yet, but they are in the internal process of approval. So let's take a look for WAD specifically. And again, WAD is a household of one. And it is going to be 5,869.
Okay, thank you so much. Anna is asking, you said resources are not counted, but I've noticed that VCLs, I apologize, I don't know what that means. I noticed that VCLs still are going out asking for those.
So those would be verification checklists. So um, as mentioned, those 5,000 that I just mentioned to the previous question, like there is a top to the program. So if you are close to that, then and there's any verification that's needed, then a VCL should be going for those. Another thing that is important to consider is that buy-in is not a program that you apply to directly, so to speak. There is, your application, your disability determination that you can submit, but you are reviewed for other programs as well. So, for example, here in long-term care, it's possible you're reviewed for that program too, and you may be eligible, and that's why we send VCLs. If for some reason those aren't returned or they don't meet the criteria for the long-term care program, then our system will evaluate for other programs. So it's possible that the member ended up in WADA, so to speak, but they were evaluated for other programs. So I would have to see the specific VCLs, unfortunately, on that case to see if they were related to WADA specifically or for any other program that they were also considered for at the time of application.
Fantastic. Thank you so much. Mary Jo is asking a similar question. Why would anyone want to be in both programs if already on the long-term care waiver? Anything else you want to add to that?
Um, the same as previous, just that I do want to clarify that you actually can't be in both programs, as in long-term care and working adults with disabilities. It's one or the other. The only thing that you can be in both is HCBS. So you can be in long-term care HCBS or you can be in WAD HCBS, but you can't be in both.
Thank you. Diana is asking, how do you know if you've already been determined eligible for HCBS?
So the HCBS itself has to do with the waivers that I spoke about earlier. So you would know if you have applied to those waivers for the brain injury, developmental disability, or any of those. Once you're approved for those, then the level of care, I don't want to get too systematic, but the level of care that is submitted along with those should trigger the review for HCBS, whether it's in long-term care or in buy-in.
Thank you so much. Bobby is asking, for those that have working adults with disabilities and Medicare for medical coverage and over the SLMB income limits, does paying the monthly buy-in premium cover the Medicare Part B, or will they also pay the Part B and also the buy-in premium?
So what does come with Medicare Part B, but that does not include the actual premium. The premium for the WAD program itself, regardless of HCBS or not, is still going to be applicable.
Thank you. C is asking, we have been told that a person on buy-in must be paid at least minimum wage or more. Is that correct?
So as I mentioned earlier, we actually don't have a minimum amount of hours that you need to work, a minimum amount of salary or wages, so that would not be correct in this case. We don't have any minimums.
Okay, thank you. Janelle has a math question. So $5,648 times 2 equals 11,296 plus 85 equals 11,381 gross income.
I'm going to need a little bit more of context because I'm not quite sure what this is referencing because the disregards that are applicable to this are, I would say $65 and then you remove 50%. So maybe that's what the times two is, but it should be 65 instead of 85. So in a nutshell of what we're trying to get to is the minimum disregards, then it would be $65 first. And then actually it's actually $20 first to unearned income. Then that can get applied to earned income if there is no unearned income. Then it would be the $65 to the earned income, and then that amount is what you divide in half. And that's going to be the amount that's total. However, I do sometimes shy away from simplifying it to that degree because there could be other allocations and disregards that are applicable. That's why I always encourage everyone to apply and contact their local sites just to be on the safe side.
Thank you. So Ashley is stating that the waivers are going away with CFC, and I forgive me, I forgot what CFC means, in June. So how will that change eligibility?
I am not quite sure what this is referencing either. Like, I don't have any information on the waivers changing anytime soon. I don't know what CFC stands for in this context. The community first choice. Okay.
Yes.
Lifeline just came through. Bear with me. Let me see.
So Ashley, this is a good question. Let's take this back and then we can circle back to this question possibly at the end. Does that work?
And just for the record, the waivers are not going anywhere, so I'm not quite sure what this is referencing. I believe that services that are included in the waivers can sometimes change, but the actual like waivers themselves are not changing.
Okay, thank you. Christina is asking, how does someone who is already on long-term care and HCBS opt into the buy-in program?
So in order to opt in, you can do it through what once the change is implemented, which would be in June. Sorry, you can contact your local case management agency. You can contact your local eligibility site. You can do it through Peak. So basically, the ways that you can currently opt out are going to be the same ways that you can opt in. So by phone, online, contacting us.
Fantastic, thank you. Linda is asking, I have two clients who received the heads up letter that they are enrolled into this program. Were they identified in the system to do this due to their income?
No, so that heads up letter it actually went out to everyone that is currently enrolled in the buy-in program, whether it's adults with disabilities or children with disabilities. It's basically just letting them know, hey, we have discontinued the premiums. The premiums are coming back. Your first letter is in April. Your first premium is due in May. So it's basically to let them know that they're coming. Now, I do want to clarify for the record that your income will determine your premium amount. So there are four different brackets as to how much you would pay in a premium. So if you're between 0 and 40% of the federal poverty level, your premium would be $0. If you're between 41 and 133%, it would be $25. If you're between 134 and 200, it would be $90. 201 to 300 is $130, and between 301 and 450%, it's $200. Now, if you're better than math than I am, I did just say 5 instead of 4. That's because I don't really consider the 0 to be a premium paying amount. It's technically 5 brackets, but 4 premiums.
Thank you so much.
Real quick, before we move to the next question, I am going to go ahead and drop in the chat some more information about CFC and the waivers for that question that was asked earlier.
Perfect. I appreciate that. Thank you, Nancy. Okay. Chandler is asking, will customers be able to set up auto pay to pay their premiums?
Yes, something that is important to note is because the premiums have been gone for so long, we are not allowing to the use of any payment method that you had arranged beforehand, because again, those may not even be valid account numbers for a lot of people. So that information will not be there when you go to set up your payment. You will need to set it up again from scratch, and then you can set up the auto payment.
Fantastic. Thank you. An anonymous question, how long does it typically take for a new applicant to buy in to receive or to the buy-in program to receive a determination?
It would depend on how, if we're talking about a determination for application without, so there's determination on eligibility, but then there's determination on disability. So what would happen, it's 45 days to process any of our applications, up to 45 days, that is, it could be sooner than that. If you are already determined disabled by the Social Security Administration, then there really wouldn't be any additional processing time. But if you do require a disability determination through our state vendor, then that could extend the process. But again, we do offer retroactive coverage, so there shouldn't be any gap in coverages.
Okay, thank you so much. Amy is asking, I do not understand how you can review someone for the eligibility of standalone LTSS, long-term services and supports, both the financial and functional eligibility, and then opt into the buy-in program. Are you going to make people receive a denial and then have an appeal to have consideration for the buy-in program?
So I'm not quite sure that I follow the question in the sense that these changes are going to apply to people who are already approved for HCBS or those long-term care supportive services that Amy is mentioning. So we really don't need to make a determination again for the functionality portion of it. All that we would be looking at is if they're currently in WAD, we would be looking at long-term care upon their renewal. If they are already, let me see here. It also it's going to depend new application versus ongoing. If it is a new application, then yes, both the financial and the functional eligibility will need to be reviewed. But as I mentioned earlier, if you will be reviewing you for long-term care first, and if you don't meet those, then you will be looked into WAD and you won't have to actually opt in at all. So again, that's new application. For ongoing members, if you were already on WAD HCBS, we'll look at you in that first renewal for long-term care. And if you don't meet the eligibility requirements, you stay in WAD. So the only point where you would need to actually opt in is if we review you for long-term care and we put you in long-term care and you do not want to be in long-term care. In that case, you would opt in into WAD. So there really shouldn't be any denial or functional eligibility review in any of these cases.
Okay, thank you so much. And I just want to acknowledge, I do see that we have two hands raised. So in a little bit, I'm going to go over to those people who have their hand raised so that they can ask their questions. Janelle is asking, premium chart was updated, but not gross on the site.
Correct. We have not implemented all the full changes because these won't go live until April 1st of 2025.
Okay, thank you. Tasha is asking, is there a document of the eligibility requirements detailed listing of the qualifications and the amounts of the premiums?
So I believe, correct me if I'm wrong, Kira, that we linked to our adult buy-in website in the HCPF website. There you should be able to see the eligibility requirements as well as the amounts of the premiums. Again, it's going to reflect mostly 2024 values since they're not, the 2025s don't go live until April 1st. There is also a section that talks about the Social Security Administration and what they consider disabilities that would qualify. And that's an actual link. So you can click that and it will take you to different qualifying disabilities. So if you're unsure if whatever it is that you need to apply for, or if your current disability meets that qualification, then you can click on that link.
Okay, thank you. And I will ask Sarah if you could redrop that link to that website back into the chat so everyone has that readily available. Thank you so much. Okay, two more questions, and I promise we're going to go to those who have their hand raised. Trisha is asking, I am not currently working, although I am in the process of job searching. Can I apply for the buy-in as a job seeker?
So unfortunately, being currently employed is part of the eligibility requirements for the buy-in program. So I can't say that you would qualify, but I can say that I would encourage you to apply anyway. As I mentioned earlier, there's no specific application for just buy-in. You would submit an application, you would get reviewed for all of our programs. So there might be other programs that you would still apply for, whether buy-in would not be one of those since you're not actively employed, but I would still encourage you to apply, not to mention that you might be found eligible for a different category. And then once you do obtain employment, then you can, as mentioned during the presentation, you can opt in to be reviewed for buy-in.
Okay, thank you. One more question, then we're going to go to the hands raised. So if someone is in the buy-in program and currently has the SLS or supported living services waiver, they will have to undergo a new evaluation.
So it would be a new evaluation. If you're in WAD with SLS waiver, then what would happen is at the time of your renewal, obviously I can't tell you when that was since it's case specific, but at the time of your renewal, you will be reviewed for long-term care HCBS. And if you're found eligible, you're going to be placed into that category that doesn't have a premium. If you do not want to be in that category and you want to go back to WAD, then you would need to opt in. But again, during this process, when we look at you for long-term care, if you are not deemed eligible, then you're going to be reviewed for WAD after that. So likely you won't have to opt at all unless you are placed in long-term care and you do not want to be in that program.
Okay, thank you. So going to those who have their hand raised, I'm going to start with Lisa. I believe I have allowed you to speak.
Can you
Are
hear
you
me?
there, Lisa? Yes.
Okay. So my question is, when someone's applying for WAD, is what you call it, a lot of these guys, what I find happens is somebody's already on SSI, but then they eventually qualify for SSDI because they now have enough work credits, or the parent retires or passes away, and then they're qualified for CDB or DACA underneath the parent's work record. If the money that they're getting stops the amount of the SSI, what Medicaid does is sends them a letter and says you're no longer disabled, and they make them do the third-party vendor at Arbor app. But they still have a Social Security disability determination because now they've qualified under Social Security's disability for SSDI. So is there a way you guys can kind of either fix that or add to the letter that, just provide the SSDI determination? So, because your guys' system is linked to SSI. So the minute SSI goes away or pauses because they're using 1619B, bam, they have to now do a completely different, that third vendor application. So I just wanted to throw that out as a potential issue that if you can help us with that. Okay. Did you want to comment? I have another question as well. Sorry.
Yes, I do want to comment real quick. So the state of Colorado is something, without getting too technical, something called 1634 state, which means that we don't require further verifications from members when the Social Security Administration tells us that they're disabled. This is to, lighten the burden on members on having to provide further documentation on eligibility. Unfortunately, once that disability determination communication from them is stopped and we're told that there is no longer a disability, then that's when we would need to involve the state vendor to make a further determination. So that's probably
So
why that loop is
yeah,
happening.
so they won't be able to just provide the SSA, you are disabled under ours for the SSDI. They actually get a letter when they switch from one program to another. Could they then just provide that, or do they have to really do the whole big application?
Let me think that through real quick.
Because it says, all your information is saying you have to have an SSA determination, which they do when they get SSDI. So maybe you could either change your documentation saying they need an SSI determination, or if you say SSA, they do have it. So it just doesn't make sense to me. I'm just
Correct. So
throwing that.
I understand where you're coming from. It's because of I do understand where you're coming from. It's because of that communication. I will take that under revision, because I'm in the process, because of the buy-in premiums returning and because of these changes. I'm in the process of doing revisions on everything on our websites. So I'll take a look at what we have out there and see if we can do better wording on that.
Okay, or decide if you can accept that determination from Social Security. Anyway, whatever. Okay, my other question is, I have a client who has, prior to adding the DD waiver onto the buy-in, they earned more, and so they had to set up an income trust. So then when the buy-in came in, they got automatically dropped into the Medicaid buy-in, but they still have to do the income trust. So I'm telling this family, if you were paying a premium, you would notice that you're only in one category. So they're in the buy-in category, but the state is still making her put all this extra money into the income trust. Is there some place or someone they can talk to help get that fixed?
So the buy-in program itself shouldn't have the requirement for the income trust. Do you know?
Absolutely, they shouldn't. But when
Mhm.
they can't get out of the income trust, but they're in the buy-in. So even, in a couple of months, you guys are going to ask them for a payment,
Mhm.
and the income trust people are still saying they have to pay this. It's not, there's a problem in a specific person here. Is there somebody we can have them call to help you guys get that fixed for this client?
Let me check to see who would be able to help.
Because
So
the
it,
income trust people said it doesn't matter, you have to do this regardless.
yeah,
You're
because
only
that
in
should,
one category at a time.
yeah, because
Yeah,
mhm.
Nancy, should we have Lisa reach out to you directly um to get this resolved? I just want to be respectful of time as we have less
Yeah,
than 15 minutes. So Lisa, I'm gonna have Sarah drop Nancy's email it directly to you so that you can follow up with this. I see Mitchell is also kind of involved in our side chat, and he said that they can connect with you to kind of get this resolved. I just want to be respectful of time.
yes, yeah, that would be fine.
Okay,
Thank
thank you. And then just last comment, you guys have a great FAQ online under March 2022. Are you planning on updating that document? There's other documents, but that one's just the best. So
Yes,
if you
that
could
one
update that,
also
that'd be
has,
heaven. Okay,
yeah,
thank
that
you.
one also has that outdated 2022 chart that we're also updating. So yes, we are in the process of updating those as well.
Yay, thank you. Sorry for all the long questions. I appreciate your help.
Okay.
Okay, thanks.
That's
Bye.
okay. Thank you, Lisa. Okay, jumping back to the chat really quick. Naomi, my son is on Medicaid buy-in. Did I hear you say that we can opt into Health First Colorado and not have a premium?
So I would need, unfortunately, a little more clarification when you say Medicaid buy-in program, if that is the working adults with disability or if that's the children's with disability program. Because the presentation that we're talking about right now is HCBS specific, so it's for working adults with disabilities. Now, I do want to state for the record that both our buy-in programs are voluntary programs, and you can opt out to be reviewed for any other program. However, if you're not eligible for other programs and you opt out of this one, then unfortunately that means that you wouldn't have coverage. So the best course of action would be to contact your local eligibility site and apply for other programs instead of opting out, especially if it's the children's buy-in program.
Okay, thank you. One more question, then we'll jump back over to the hands raised. Brent is asking buy-in method for online payment, credit cards, debit cards, reoccurring payments, or one time only each month.
So cards should be both are applied, and you can do it either way. You can do a one-time monthly payment. I believe there's other options for mailing a check and paying in person as well. And again, you can do one time, you can do recurring payment methods. You just need to set up how often you want it paid online. And in the link that was posted in the chat, you'll see all the different methods in which you can pay those monthly premiums.
Okay, thank you so much. Jumping back over to the hands raised, I believe Gail, you are up next. And I have asked you to unmute. Gail? Going one. Oh, yep.
Sorry, I didn't know my hand was raised, but I can ask my questions. I used to work for Social Security, so that's why my question was about when I worked for Social Security, the disability determination group that made the determination for Social Security was also the same group that made it if you didn't go through Social Security. So I'm curious if that's still the same or if they have changed. I don't work for Social Security anymore, obviously.
I'm sorry, I don't know that I understand the question. Could you repeat that?
So when I worked at Social Security, when somebody gave an application for SSI or SSDI with a disability, and it has to be reviewed for determination on whether you have a disability, I was told at the time the department that reviewed the determination for a disability in the state of Colorado for those applicants was the same department in the state of Colorado that you would go through if you weren't applying for Social Security.
Okay, so as I mentioned earlier, we have that like agreement with Social Security Administration where they let us know when a member is does have a qualifying disability. But if it needs to be determined on the state side, we actually have a vendor called Arbor Group, ARG, and they are the ones that actually make the determination.
Now there's two separate. What years ago it was the same. So because I'm wondering, the stub on the toe used to be, well, if you don't go through Social Security, it still takes 4 to 6 months. So how long does the Arbor Group, does it still take them 4 to 6 months, or is it
No, it does not take that long. We actually have dedicated escalations where if our members are experiencing like long waits such as that, there are several cases that might be more medically complex that could take a little bit longer, but usually it shouldn't. And we have member escalations in place to make sure that that doesn't happen, especially since we have retroactive coverage of up to 90 days. So there shouldn't be a gap, but we do have escalations in place to make sure that that doesn't happen.
Great. That was just a curious. My main question is I talk a lot to families who are asking me about the buy-in program, and this has been helpful for me. But what I get from families and from clients is, well, yeah, I want to be in the buy-in program and get my waiver services because most of my individuals need both. But they're scared because what happens if I lose my job? Because if you go into the buy-in program and then you're making too much money to stay connected with Social Security, if you lose your job, I don't know what to say to them to provide them with a comfort level of.
I understand what you're saying. Unfortunately, the employment portion is a requirement of the working adults with disabilities. So, unfortunately, if they were to lose employment, the only other option would be to review them for other programs. And again, we definitely would be looking at them for long-term care HCBS that they're on waiver services, but they would need to meet the requirements for both financial and functional for that program as well.
Right, so basically, for some clients, I'll think it through, they'd have to spend down that money and possibly reapply all over again to Social Security for some, and for some not, depending on,
If they're not employed, correct, because that's an actual eligibility requirement for the WAD HCBS program.
I guess I'm just putting it out there that that's what I get back from parents and families is I want to do this, I want to pay in, but the what if is what stops them.
I understand.
So if there's some kind of gap there, because it's not like they don't want to work, it's just we all, people have all been there, things happen. So thank you.
No problem.
Thank you, Gail. Okay, jumping back over to the Q&A. When HCPF says all long-term care requirements must be met, does that mean functional and financial requirements or just functional? If this includes long-term care financial requirements, how will that work with different financial eligibility requirements for the buy-in and HCBS?
Okay, so it is both. It does need to be functional and financial. And the question that comes to mind to many is if you are allowed to have a higher income for WAD with HCBS, then you get reviewed for long-term care, and that income is much higher, then how would I qualify? And the reality is they may not qualify because, again, that income is higher than the requirements for long-term care. So what would happen is we review you for long-term care, you don't meet the eligibility requirements, and then you would be re-reviewed for WAD with HCBS. So likely what it's going to mean is that they would just remain in the WAD with HCBS in the program that they are. We're just going to be reviewing them either, well, this is an ongoing case, so we'll be reviewing them at renewal for this first upcoming renewal, and then after that, they just remain in WAD HCBS as long as they keep meeting the requirements. I do want to clarify that when I say that we're going to review WAD HCBS members for long-term care HCBS at renewal, is only one time. It's only during their first renewal after this change is implemented. After that, they will continuously remain in WAD with HCBS as long as eligible.
Thank you. Let's go back to those who have their hands raised. Leo, I'm asking you to unmute.
Yeah, can you hear me?
Yes.
Yeah, the question was, so I keep hearing this is for employed adults, but what if they're on Social Security, like old age pension, but they make more than they're over the qualification income for the Medicaid. Do they qualify for this program? Can they buy in?
If it's a new application, and I'm sorry if I understood that they're not currently working, but they're over income for long-term care, it is possible that they don't qualify for buy-in. Well, they won't qualify for buy-in because working is a requirement, as mentioned. I would still encourage them to apply because there are disregards that could be applied to many of our other programs. So the short version is still apply. I always encourage everyone to still apply, even if they think they're not under the thresholds. There are some case-by-case scenarios that sometimes might qualify you, so still do please apply.
So we'll just have to apply with the single point entry like Rocky Mountain, right?
Yes, or with your local county eligibility site.
Okay, or Social Security. Okay. All right. Thank you very much.
No problem.
All right. Thank you, Leo. Being respectful of everyone's time, we only have a couple more minutes left. I know that we have a few more hands raised and we definitely have a lot more questions in the Q&A. So I just wanted to follow up that there will be the FAQ document that is on that website is in the process of being updated. And so that will be updated and reposted on the website. Additionally, I just wanted to put Nancy's contact information. If you do have a very pressing question, feel free to shoot Nancy an email. I believe there's also, if you have a case specific question, that there's an eligibility email address that I'm hoping Sarah will drop back into the chat. So those are for member specific and very very specific questions. Please shoot it to that inbox instead of Nancy's inbox. I also just wanted to reiterate that this is the first of 2 meetings we're hosting. So we're hosting this exact same meeting once again on Thursday, March 13th at 1 p.m. So the presentation is pretty much going to be the same, but if you have a question or concern that you want to bring to that meeting, you're welcome to join us as well. But just know that the presentation and the content is going to be the same as today's meeting. And with that, we want to thank you all for attending today. Lots of questions and comments. I just want to reassure everyone that we are capturing the questions that you dropped into the Q&A box. So we are capturing those questions, and some of them might be included in that FAQ document. Again, you will all receive a follow-up email probably by the end of next week with a copy of today's slides, as well as a recording for today's meeting. So with that, I don't know, Nancy, if there's anything else that you want to say, but I just want to thank you everyone for taking an hour out of your day. We really appreciate it. And yeah, Nancy, anything you want to add?
Nothing, just thank you for your time and for participating. And just a reminder, if you have any further questions about the presentation, about the buy-in programs, please feel free to reach out to me.
All right. Thank you so much.